This community in hematology and coagulation have really had a tremendously positive effect on cardiovascular disease. Having had this effect, there's still a ways to go, and there's still a ways in which patients with cardiovascular disease can be helped. And what we really need is a superior balance between efficacy and bleeding. It's very difficult to have efficacy to stop thrombosis without bleeding, but you want to get a profile of agents or drugs that can do this. Some are better than others, so we have to keep pushing that. And why do we as cardiologists want that? Well, in patients who have serious cardiovascular disease, we have good agents. But in patients who have less serious disease, we don't want to expose them to a bleeding problem. And therefore, an improvement of this balance between efficacy and safety needs to be improved. There's a huge population of patients who've not had a heart attack and yet who are candidates for heart attack, and we don't have good drugs for them right now. And the second population that's important, we are seeing more and more elderly patients who have multiple disease. They have comorbidities. They may have, for example, atrial fibrillation and acute coronary syndrome. That's a tough combination. They're both common conditions. We have treatments for each one alone, but we don't have a treatment for an increasing number of patients who get both. So the issue is really one of dissociation. I have said for many years that if you're going to have an efficacious drug, you have to have bleeding, and I say that there's no free lunch. I don't think that there's a free lunch, but I think there's always going to be some risk of bleeding. But I would like to say you can get lunch much cheaper. In other words, you don't have to have the serious bleeding that we see. And I think that's where I think the community can help us a lot. You know, it may be some combination of agents, and it may be some combination of patients. Everybody isn't the same. And you know, there are genetic differences which we can now identify. So maybe it's not the same for everyone. We may have to practice precision medicine, is what it's called, personalized medicine, so that not everybody gets the same drug.